Before we begin, remember this video is for informational purposes only. It is not a recommendation or endorsement for any medication including Mounjaro, tirzepatide. The goal is to provide a general overview based on current research and clinical understanding. This should never replace professional medical advice, diagnosis, or treatment. Only your healthcare provider can give guidance tailored to your unique health needs. Making medication decisions without your doctor can have serious consequences. We'll explore what happens when someone stops taking Mounjaro, but this is purely educational. Use this information to help you form questions for your doctor, not to guide your actions. Any changes to your treatment plan should be made with medical supervision. Your health is your most valuable asset. Always work collaboratively with your healthcare team. Never self-diagnose or self-medicate based on online information. To understand what happens when you stop taking Mounjaro, it's important to first get a clear picture of what this medication is, how it works in the body, and why it's become such a significant option for so many people. Whether you're considering starting, currently using, or thinking about stopping Mounjaro, having a solid foundation of knowledge will help you make informed decisions about your health. Let's begin by looking at the basics. Mounjaro is the brand name for tirzepatide, a relatively new injectable prescription medication. It was first approved for use in adults with type 2 diabetes, and it's administered as a once-weekly injection. The goal of Mounjaro is to help people manage their blood sugar levels more effectively, especially when diet and exercise alone aren't enough. Unlike oral medications, Mounjaro is delivered through a small injection, typically into the abdomen, thigh, or upper arm. This method allows the medication to be absorbed gradually and consistently, providing steady support for blood sugar control throughout the week. Mounjaro is specifically designed for adults with type 2 diabetes and is not intended for those with type 1 diabetes, or for people with a history of certain rare conditions. It's most effective when used as part of a comprehensive plan that includes healthy eating, regular physical activity, and ongoing medical supervision. For many, it's a valuable addition to their diabetes management toolkit. One of the most notable effects of Mounjaro, and a reason it's gained so much attention, is its impact on weight. Many people who use Mounjaro experience significant weight loss, sometimes even when weight loss wasn't their primary goal. This has led to its use not only for diabetes, but also as a tool for chronic weight management in certain cases, under medical supervision. What sets Mounjaro apart from other medications is its unique mechanism of action. It's known as a dual agonist, which means it targets two different hormone receptors in the body, GLP-1 and GIP. These hormones play a crucial role in regulating insulin production, appetite, and digestion. By activating both, Mounjaro helps the body respond more effectively to food and manage blood sugar levels. When you take Mounjaro, it stimulates these hormone pathways, leading to increased insulin release when your blood sugar is high, and at the same time, it helps suppress your appetite. This dual action not only helps lower blood sugar but also makes it easier to eat less and feel satisfied with smaller meals. As a result, many people find themselves feeling full for longer periods after eating, which can naturally lead to reduced calorie intake and gradual weight loss over time. This effect can be especially helpful for those who have struggled with cravings or portion control in the past. It's important to remember, though, that Mounjaro is a tool for managing chronic conditions like type 2 diabetes, and in some cases obesity. It's not a cure. The medication helps control symptoms and improve quality of life, but it doesn't eliminate the underlying conditions. Ongoing lifestyle changes and regular medical checkups remain essential. The benefits of Mounjaro depend on continued use. When you stop taking it, the stimulation of those key hormonal pathways comes to an end. This means the effects on blood sugar, appetite, and weight management may gradually diminish or disappear, and your body may return to its previous patterns. Understanding how Mounjaro works, and what happens when you stop, is essential for anyone considering changes to their treatment plan. It's not just about the medication itself but about how it fits into your overall approach to health and well-being. In the next sections, we'll take a closer look at the specific consequence of discontinuing Mounjaro, including what you might expect in terms of blood sugar, weight, and overall health. We'll also discuss strategies for making any transition as smooth and safe as possible. Please keep in mind, this video is intended as a general overview and educational resource. It's not a substitute for professional medical advice, diagnosis, or treatment. Every person's situation is unique, and decisions about starting, stopping, or changing medication should always be made in consultation with your healthcare provider. If you have questions or concerns about Mounjaro or your health in general, be sure to reach out to your doctor or a qualified healthcare professional. They can provide guidance tailored to your individual needs and help you make the best choices for your long-term well-being. While on Mounjaro, users may see several benefits, though results vary. This medication has been designed to help manage both weight and blood sugar levels, making it a versatile tool for those dealing with type 2 diabetes and obesity. The journey with Mounjaro can be transformative, but it's important to remember that individual experiences can differ based on various factors, including lifestyle choices and adherence to the prescribed regimen. The most notable is often significant weight loss, especially when combined with diet and exercise. Many users find that they can fit into clothes that were previously too tight, and the visual progress can be incredibly motivating. Before and after photos often tell a compelling story of transformation, showcasing the tangible results of their hard work and commitment. For people with type 2 diabetes, improved blood sugar control is another key benefit. Regular monitoring of blood sugar levels can show a marked improvement, often leading to healthier readings. This can be a significant relief for those who have struggled to keep their blood sugar in check, providing a sense of control and stability in their daily lives. Mounjaro helps the body use insulin more efficiently and can lower A1C levels. This is crucial for long-term health, as maintaining lower A1C levels can reduce the risk of diabetes-related complications. Doctors often highlight this improvement during consultations, using visual aids to explain how the medication is making a difference. Many users also report reduced appetite and fewer food cravings, making it easier to stick to a lower-calorie diet. This can be particularly beneficial for those who have struggled with overeating or emotional eating. The ability to make healthier food choices without feeling deprived can lead to more sustainable weight loss and, overall, better health. This quieting of food noise can be life-changing for those who've struggled with constant hunger. The mental peace that comes from not being preoccupied with thoughts of food can improve overall quality of life. Many users find that they can focus better on other aspects of their lives, such as work, hobbies, and relationships, without the constant distraction of hunger. Secondary benefits may include better mobility, lower blood pressure, and improved mood. Enhanced mobility can make daily activities easier and more enjoyable, while lower blood pressure can reduce the risk of heart disease. Improved mood is often a natural consequence of feeling healthier and more energetic, leading to a more positive outlook on life. These changes can reduce the risk of cardiovascular disease and boost self-esteem. Feeling more confident in one's appearance and health can have a ripple effect, improving social interactions and overall mental well-being. The reduction in cardiovascular risk is particularly important for long-term health, providing peace of mind for users and their families. The combination of physical and psychological improvements makes Mounjaro a powerful tool for managing diabetes and weight. Users often report a renewed sense of hope and motivation, feeling empowered to take control of their health. Regular check-ins with healthcare providers can help track progress and make any necessary adjustments to the treatment plan. But these benefits are closely tied to continued use of the medication. Consistency is key to maintaining the positive changes, and users are encouraged to follow their prescribed regimen diligently. Setting reminders and establishing a routine can help ensure that the medication is taken as directed, maximizing its effectiveness and sustaining the benefits over time. So, what happens when you stop taking Mounjaro? Evidence shows most benefits reverse after discontinuation. Weight regain is common, especially if lifestyle changes aren't firmly in place. Appetite and food cravings often return, making it harder to maintain weight loss. For those with type 2 diabetes, blood sugar levels can rise as the drug's effects wear off. The body reverts to its previous state, as Mounjaro manages but does not cure chronic conditions. This is a physiological response, not a personal failure. Stopping should always be done under medical supervision, especially for diabetes management. Why do these reversals happen? It comes down to biology. Our bodies are incredibly complex systems, designed to maintain balance and stability. This is often referred to as homeostasis. When you introduce a medication like Mounjaro, it acts as an external manager, helping to regulate key functions such as appetite, insulin, and metabolism. Mounjaro acts as an external manager, directing appetite, insulin, and metabolism. It essentially helps your body to function more efficiently, especially in areas where it might be struggling. For instance, it can help to control your appetite, making it easier to stick to a healthy diet. It also helps to regulate insulin levels, which is crucial for managing blood sugar. But it doesn't permanently change your body's factory settings. Think of it like a thermostat in your home. You can adjust the temperature, but the thermostat will always aim to return to its set point. Similarly, Mounjaro can help to adjust your body's settings temporarily, but it doesn't change the underlying set point. When the drug is removed, your body returns to its natural set point, a weight range it's programmed to defend. This is why many people experience weight regain after stopping the medication. Your body is simply doing what it's designed to do, maintain balance. After weight loss, the body increases hunger hormones and slows metabolism to regain lost weight. This is a natural response, driven by your body's desire to return to its set point. It's not a failure on your part, it's just biology. Mounjaro overrides these signals, but once stopped, the body's natural drive to regain weight returns. This is why it's so challenging to maintain weight loss without ongoing support, whether that's through medication, lifestyle changes, or both. The same goes for blood sugar. Mounjaro helps compensate for insulin resistance, but stopping removes that support. Insulin resistance is a key factor in conditions like type 2 diabetes, and managing it is crucial for overall health. Unless another treatment or major lifestyle change is in place, blood sugar and weight often return to baseline. This is why it's so important to have a comprehensive plan in place, one that includes medication, diet, exercise, and regular monitoring. This isn't about willpower. It's a powerful physiological response. Your body is hardwired to maintain balance, and it will do everything it can to return to its set point. Understanding this can help you to be more compassionate with yourself and more strategic in your approach to health. The medication manages symptoms, but the underlying condition persists. This is why ongoing management is so crucial. It's not just about taking a pill, it's about a holistic approach to health that includes regular checkups, lifestyle changes, and possibly other treatments. That's why ongoing management is essential. It's a continuous journey, one that requires commitment and support. But with the right plan in place, you can manage your health effectively and improve your quality of life. Clinical studies confirm these patterns. In the Surmount-4 trial, participants who stopped tirzepatide regained about half the weight they'd lost within a year. Those who continued the medication maintained or even lost more weight. This shows tirzepatide's effects depend on ongoing use. Obesity, like high blood pressure or diabetes, is a chronic relapsing disease. Long-term management, often with medication, is needed for many people. Lifestyle changes are crucial, but may not be enough to counteract biological drives. Medication provides support that's hard to replicate with willpower alone. These findings help set realistic expectations for patients and doctors. Maintaining weight loss often requires ongoing treatment and support. One of the biggest changes after stopping Mounjaro is the return of appetite. While on the drug, many experience less hunger and fewer cravings. Once discontinued, these effects vanish, and hunger can return quickly and intensely. Cravings for high-calorie foods may reappear, as the body's natural signals take over. The food noise many found relief from often comes back, making eating habits harder to control. This is a biological, not a psychological shift. Managing renewed appetite requires preparation and support. Behavioral strategies and nutritional counseling become even more important. The skills built while on medication are still valuable, but the challenge increases. Recognizing this as a normal response can help reduce self-blame. For people with type 2 diabetes, stopping Mounjaro means losing a key tool for blood sugar control. The medication's support for insulin secretion and glucose regulation fades as it leaves the body. Blood sugar levels often rise, returning to pre-treatment levels. This isn't a failure, it's the chronic condition resurfacing. Discontinuation must be managed by a doctor, who will create a new plan to maintain glycemic control. Abruptly stopping without a replacement can be dangerous. Doctors may prescribe alternative medications and increase monitoring. Lifestyle changes remain important, but medication is often necessary. Transitioning off Mounjaro is a medical process, not a casual decision. The most important message: always involve your doctor in medication decisions. Never start, stop, or change a prescription like Mounjaro on your own. Your doctor will create a structured, personalized plan for any transition. This includes setting expectations about weight, appetite, and blood sugar changes. Enhanced monitoring, like more frequent check-ins and lab tests, will help track your progress. Your doctor can connect you with resources like dietitians or therapists for extra support. The goal is a safe, managed transition to the next phase of your health journey. If one treatment stops, your doctor will help find the next best approach. You're not alone. Medical oversight and support are essential. Your long-term health is a team effort. In summary, the benefits of Mounjaro, weight loss, appetite control, and better blood sugar, are tied to continued use. Stopping the medication often leads to reversal of these effects. This is a normal physiological response, not a personal failure. Understanding this helps set realistic expectations and empowers better conversations with your doctor. Always consult your healthcare provider before making any medication changes. Your health journey is ongoing, and medications are just one tool along the way. The best results come from a comprehensive plan developed with your doctor. Open communication is the foundation of safe, effective care.